My name's Ryan. I'm one of the chief residents at MSU Sparrow with the PM&R department, and we are having our discussion about our program. I will go ahead and give it off to one of our other chief residents, Dominic Utri.
Hey everyone. Happy to be meeting with you. Happy to answer any questions at the end. This is our intro page. Not being a Michigan native, the fact that the Block M at the Spartan helmet are right next to each other doesn't faze me quite as much as some of the Michigan natives. But University of Michigan recently acquired the main hospital that we work at. So this is a University of Michigan health facility. All of our residents are also adjunct faculty at Michigan State University, College of Osteopathic Medicine, and we rotated at another large hospital system in the state of Michigan, the McLaren system, as well as the Mary Free Bed Hospital down in Grand Rapids. So our base is out of Lansing, Michigan, which is the capital city, but we do travel to a couple different areas that are a little bit of a drive away. But all in all, Sparrow Hospital is our home base. Um, then the McLaren facility in Lansing, McLaren Greater Lansing, is just about a 10-minute drive from Sparrow. And the MSU campus is about a 12-minute drive, so all very accessible for the majority of the rotations that you'll be doing as a resident in our program. We do travel to Flint, Michigan, which is about a 45-minute to an hour drive, depending on weather and there's never traffic's never really an issue being in the Midwest, but we'll travel to Flint to both the McLaren Hospital there to do some inpatient rehab as well as a pain clinic. We and then we also in third year send our residents down to Grand Rapids um, to what I affectionately refer to as the mothership, the original Mary Free Bed Hospital. That's about an hour, maybe an hour and 15 minutes, depending on more construction going that way. Um, for those rotations that we're traveling a little bit further, we are reimbursed. It's a $750 reimbursement when we go to Flint, and that's per month that we go to Flint. And it's $1,000 per month that we go to Grand Rapids. We end up going to Grand Rapids for 3 months during the PGY3 year. Um, Flint is a little bit variable, but it averages out to be about 2 times a year from PGY2 year on. So a little bit about Lansing, Michigan, where, like I said before, kind of the majority of our rotations are. That's the capital city of Michigan. Just a short 12-minute drive away is East Lansing, where Michigan State's campus is. And so lots of good resources on that campus. It's a gorgeous campus, home of Big Ten athletics, friendly college town. The college football, we have the Lansing Lugnuts in town, which is a minor league baseball team. I think there's a minor league soccer team in town as well. And then obviously the Breslin Center and MSU sports and things like that, as well as lots of cultural activities and diversity that goes along with being in a big university town. Um, in addition to us going to different locations in Michigan for rotations, on those weekends you have off, it's a short drive to Detroit, Ann Arbor, Grand Rapids, some of these bigger cities that also have fun things to explore. Um, it's about an hour and a half drive over to the western coast of Michigan as well, where there's lots of good beach towns and things to do. Um, 2 to 4 hour drive to hundreds of lakes, camping, access, biking, downhill skiing. Nothing like they have out west, of course, but um, it'll satisfy the need to do any skiing if you so choose. Chicago's 4 hours away. You can take a train, pretty affordable option. There's plenty of restaurants and things to do in town in Lansing itself. A lot of our residents have families, and I would say it's a very safe place to live and a good place to raise a family. And it has the added benefit of having a low cost of living, just missing those mountains and salt water. Um, so University of Michigan Health Sparrow is our residency's home base, like I said. University of Michigan Health Sparrow has a 733 bed acute care hospital. We're a level one trauma center. We're a level one stroke center. So you get exposure to a lot of different pathologies, both in intern year and beyond. And our inpatient rehab facility at Sparrow has 40 beds. McLaren Hospital in Lansing is a 240 bed acute care hospital, no inpatient rehab, but we're over there doing consults, inpatient EMGs, and we also do inpatient EMGs at Sparrow. The McLaren Flint Hospital, 378 bed acute care hospital. And then we do inpatient rehab there in a 22 bed facility. This You get a little bit different flavor of inpatient rehab in Flint because at Sparrow and in Grand Rapids, that I'll talk about in just a second, we're the primary team. But when we go to Flint for inpatient rehab, we are consultants basically on the rehab floor. So it's a little bit less work burden. Don't have to do like med racks and discharge summaries and things like that. You can really focus on um, the rehab medicine. And then Mary Free Bed in Grand Rapids is a large 167 acute care inpatient rehab hospital. When we go there in third year, we have 2 dedicated months of spinal cord injury, and then 1 month of pediatrics. And there's days where that are less busy than others. So if you so choose, you want to get more exposure to a dedicated traumatic brain injury unit, um, complex medical patients. They can support ventilated patients at Mary Free Bed as well. So it's a really good resource and a really strong part of our program that we get to go down to Grand Rapids um, and see how things work there.
I'll start to highlight some of the other aspects of our program. So we are a categorical program with that built-in internship. As such, we have a little bit more say in what our PGY 1 year looks like, and we try to make it as PM&R adjacent as possible. One of the highlights of our program that we'll talk about later is that this is fairly resident-led in some regards, and these rotations do change from time to time. For instance, one of our newer rotations is a 2-week neurosurgery rotation as part of the U of M merger that we underwent recently. We had a new group of neurosurgeons come through. They're very into teaching and they want to get us involved in their program as well. And so they have been gracious enough to offer us a 2-week rotation with them that we will spend largely in the outpatient setting. Although I heard from one of our current interns that they offered him to come into the ORs with them as well if he would like. But as you can see, we'll post this slideshow to you all later that you can take a look at. But I do want to highlight that we do things like the neurology rotation for 2 months, a trauma surgery rotation. We do radiology, as well as our 1 month of inpatient rehab, where you start to learn the floor and you get that 1 month experience at the end of your intern year to start to build up your practice with us. Again, I'll post this later so you can read through it a little bit more in depth, but years 2 through 4, we have a wide mix of inpatient and outpatient rotations. That first year in the PG or your PGY 2 year, your first year as a quote rehab resident, you're now getting your feet wet on the IPR floor, as well as a good mix of outpatient exposure, including things like consults, EMGs, sports and spine exposure, and some LTAC coverage there. You can see as we go through from PGY 2 through PGY 4 year, you're getting less inpatient exposure and a little bit more outpatient exposure. Although PGY 3 year, you do have those 3 months spent consecutively up at Grand Rapids, where you get more focus on spinal cord injury and pediatrics. Some more highlights of our program. We're a well-established program going back to the 1990s. We were duly accredited by both the ACGME and the AOA for several years prior to the single accreditation system, and we may continue to seek this dual accreditation in the future. As a resident at our program, you're an employee of both UMH Sparrow as well as adjunct faculty at MSU Com. As such, you have all of the resources that both institutes have to offer. We have access to vast libraries through both Sparrow as well as MSU Com. And we also get money. We'll talk about this in a little bit, but we get money for things like trips and education and grants through both of these programs. Again, we're a categorical program. I think that really helps us to build up those relationships early on in our program with other consulting services that we'll work with throughout our 4 years. And another huge highlight for our program is that we primarily use Epic as our EMR. We also have access to Cerner and Athena, although Athena in the near future will switch to Epic access as well. So then we'll be down to just Epic and Cerner usage. That change should come sometime within the next 6 months. And then our main hospital at Sparrow is a level 1 trauma center, and we have access to a level or a comprehensive stroke center as well. And a lot of our consults and admits come from these referral sources. Additional highlights, we have strong program faculty guidance as well as mentorship from both upper level residents and the faculty. Dr. Andary, who is here today, he leads dedicated rounds on the floor every Tuesday morning with a PGY2. These rounds are a little bit more slower paced. However, they're very educational and they help build a strong foundation. EMGs are taught with Dr. Andary as well on 2 half-day clinics per week. As mentioned here, Dr. Andary will be stepping down as our program director in October of this year. Dr. Gregory Gilmore, who is also here tonight, he is currently the APD and actually a former resident of our program. He will be taking over as the PD while Dr. Andary steps down to the APD for at least 1 year. We also have EMGs all 3 years of our PGY2 through 4, both inpatient and outpatient EMG exposure. And then we have strong outpatient ultrasound guided and fluoroscopy guided injections. Again, we're attached with Michigan State. Some of our attendings are Michigan State sports physicians, and we have access to some of the care that they offer to the sport athletes. And then we have strong exposure to toxin injections and all sorts of outpatient clinics that you might have exposure to here. Our program is very resident driven. The residents have a say in what our program looks like, what the didactics give us exposure to. Our attendings are constantly asking us for feedback. And I think that that's a huge, strong aspect that our program offers. As PGY4s, we are also given the opportunity to be co-chiefs if you would like to. Along with the co-chief comes the ability or comes an additional stipend. We have 2 chiefs who do didactics, 1 chief that does scheduling, and another chief that goes over anatomy. Finally, our program offers home call. You do home call for 1 week every month during your IPR months, and then you have 4 to 5 weekends per year where you're a backup call resident, basically helping the residents who are on the floor do chart review in order to help make them a little bit more efficient and speed up their weekends. In all honesty, this is a very light call schedule that we have, and I'm very grateful for that. We also have some fellowships attached with our program. We have 2 fellowships. There's a 2-year sport, interventional spine, and EMG fellowship. This is through Michigan State, and it has a 1-year accredited sports aspect of the fellowship. We also have a 1-year interventional pain fellowship through Flint. This is also through MSU, however, but you do travel to Flint for this primarily, and this is a non-accredited interventional pain fellowship. About 50 to 100% of our residents pursue fellowship each year. Recent graduates have gone through and done pain fellowships, interventional spine fellowships, sport and spine, cancer, palliative care, pediatrics, and neuromuscular. So we have a wide variety, and all of our fellows seem well prepared for their fellowships. And with that,
Just a
I'll
little
pass it on
bit.
to Steve.
Yep, just a little bit about our didactics. They are 4-hour sessions, typically on Monday mornings. There's a combination of things that we cover. You'll have guest speakers, interdisciplinary lectures, journal club, a lot of hands-on experience. We have a couple ultrasound machines on the floor that we bring in. We more recently have started presenting interesting cases that we see on our IPR months. Just a host of all this, starting for PGY2s in the first couple months of the PGY2 year, they go through a pretty intensive anatomy course along with a MSU cadaver lab at the end of it. That's typically incorporated in our didactics as well, so we get a good refresher on anatomy. And then throughout the year, we'll get opportunities for, again, ultrasounds, and 10X workshops, and also Botox workshops. As far as conference and education opportunities, through Sparrow GME, we get $1,500 per year as an educational stipend. If whatever you don't use at the end of the year does roll over, this can be used on books, question banks, even scrubs in any conferences that you wish to go to. As part of MSU, however, you get 2 conferences paid for if you do present a poster or a presentation there. During 4th year, you do have an opportunity to practice EMG and neuromuscular medicine in Zambia. This is funded as well. During PGY 3 year, you go to a prosthetics and orthotics course in Chicago, Illinois, which again, this is funded. And then the program is pretty good about giving you time off for fellowship interviews and any professional interviews that you have. We do tend to promote a osteopathic focus. I think we are very lucky that Sparrow offers this service, which we can offer to our patients as another pain modality. Several of our PM&R faculty do practice OMM, both inpatient on consults and the outpatient setting. So plenty of opportunities there if this is something that you want to pursue while you're with us.
This is a 5-minute warning.
Sure. There is an OMM rotation during your intern year as well. With all this being said, we do welcome MD applicants who are happy to have you. Additional perks, you are, like Ryan mentioned, you do hold a faculty position at MSU. You get a ton of perks with that. As a resident, you get $1,800 a month as a food stipend to spend in our cafeteria, and then $100 at McLaren Flint. And then just some of the other perks as an employee of Sparrow, the health, dental, and vision insurance, some other discounts. As a resident, you do get 20 days of vacation, plus recognized holidays, and then additional time off for education and conferences. Probably one of the more important slides for you all here today regarding rotations and interviews. I believe most of the audition rotations are done through vSLO now. I know that can be difficult sometimes. If you do end up with an audition rotation with us, this tells us that you are interested. You do not need to signal our program. This is not a trick. Take it as it is. As far as interviews, for the time being right now, we still plan to conduct virtual interviews as long as it's the national recommendation. If you do not rotate with us, don't worry. There's plenty of opportunities. Reach out to us. Show your interest. We do host Zoom didactics sometimes. You can join as well. And just other ways to show interest, mentioning UMH Health Sparrow in the personal statement and then signaling us.
And that is everything we have. I will be posting a link to this PowerPoint in the chat, so you can feel free to contact us. You can take our emails down now. Feel free to contact any of us there. But now we can open up for questions. We also have Dr. Andary and Dr. Gilmore here. If there are any questions for them, we're happy to answer any.
Can I make one comment? This is Dr. Andary. The slides from last year about the signal program signal were when you had 5 signals. You guys have 20 signals this year. So Steve, we didn't talk about this, but if they they rotate and they don't put us in the top 20, that wouldn't be particularly good. So I'd suggest you waste one of your top 20 signals on us if you want to come here. You guys are going to have to decide. The students are going to have to decide that. So otherwise, good job,
Thanks
guys.
for clarifying that.
Yeah. Questions?
There's a chat that basically that asks how involved our program is with adaptive sports within the state. I'm not sure I can speak, to the entire state, but MSU has a pretty strong adaptive sports program that's continually being added to and strengthened. And we have a pretty good relationship with the gentleman who runs that program. And there's really frequent opportunities for us to volunteer and get involved with that. One of our didactic sessions every year, which is my favorite, we actually go and we play an adaptive sport with Peter, who is the leader of that adaptive sports program. So when I'm not crashing into my co-residents in a wheelchair playing wheelchair basketball, we're having a lot of fun. So there are opportunities to get exposed to adaptive sports.
This is a 2-minute warning.
Yeah. So yeah, there's opportunities to work with Peter. Pretty much, he's trying to get us involved. I see some other questions here. Do we support visas? We have not been able to support visas. We don't have a minimum score for the step 2. What am I missing, guys?
No, I think, Dr. Andy, we should add that not only do we not have a minimum for step 2, but we have not traditionally filtered by step score when inviting for interviews either. We review entire applications.
Absolutely. Yeah.
To date, we've not applied that filter.
Yeah. And we've had residents accepted, graduated, passed their boards in the past who have flunked boards. So.
Who have flunked step 1 or step 2, to be
Yes.
clear.
Sorry. Yes. Thank you.
There's a question about IMGs applying for rotations with us. I don't know if Dr. Andere, Dr. Gilmore have more information about that or if that's allowed.
We are really full on our rotations right now, and we pick local medical schools like Michigan State, and we have had some foreign grads rotate with us, but it's hard right now. Getting in is difficult. I mean, you guys have looked, Ryan, and you've looked at we've got waiting lists, so it'll be very difficult to get in at this stage.
And I'm a foreign grad and I'm an MD and I matched here and I'm the APD about to become the PD. So if you're a foreign grad and you can't rotate with us, at least apply and you definitely have a shot here.
Good point.
Well, thank you so much for this presentation and thank you for answering some questions at the end. If anyone has any more questions, what's a great way to reach you?
I put our PowerPoint in the group chat. At the end of the PowerPoint, it has all of our emails there. Feel free to contact us. Dominic and I are 2 of the chiefs. We tend to field a lot of the questions from medical students and rotators, so you can feel free to contact us directly unless you have a specific question for anyone else here.
Okay, super. Thank you again.